Hello, friends and colleagues. My name is Stanislav Chernonog, the author and creator of the online school of Vector Massage and Somatics, and today we will talk about an important topic, imperfections in the buttocks and how to deal with them. The pelvis and the buttocks in particular are extremely important for procreation, and the buttocks can tell you a lot about the state of your pelvis. If the pelvis is in poor condition, then the buttocks will follow. Moreover, the condition of the buttocks reflects the state of the reproductive organs. In both men and women, if there are problems with the reproductive organs, it will also affect the condition of the buttocks. Our discussion today will specifically be focused on women. Women bear children. This is possible only if the pelvis and structures that lie beneath are in good health. And because women carry children, it is important that the pelvis is in good health. After giving birth, she will also be carrying the child in her arms for extended periods of time. Accordingly, if the supporting function of the pelvis is not in good health, the child will be at risk. The health and shape of the pelvis have had a large impact on the biological and evolutionary development of our species. That's why it is important to have a pelvis and buttocks that are in good health. And in this video, we will talk about what kinds of problems can arise in the pelvis and buttocks, and in which direction it is necessary to make efforts in order to bring the pelvis and buttocks into good health. Using the example of our model, we will analyze the main problems that affect the appearance and at the same time affect physical health. In the first place I would like to draw your attention to is the sacrum. The sacrum is the place where the large gluteal muscles are attached, and this is a place where the ligaments of the sacroiliac joint are attached. If the large gluteal muscles do not work properly, then this will lead to inflammation at the attachment sites. If the ligaments have an excessive range of motion, this will lead to inflammation of the ligaments, and this can cause fluid to accumulate in the sacrum area. You will be able to observe this as an excessive amount of subcutaneous fat and soreness when pinching the area. How does this affect the appearance? Due to the fact that there is an excess volume in the sacrum, the height of the gluteal muscles will be less pronounced. That is, the buttock will look flatter. The second obvious problem is a banana-shaped fold. Here, fat accumulates under the buttocks. This is due to the fact that we have impaired lymphatic outflow through the inguinal lymph nodes. Accordingly, the body needs to put the fluid somewhere, and the body finds a great place under the buttock. How does this affect the appearance? The buttock looks flatter and lower, meaning the legs look shorter. The next problem that I would like to draw your attention to is the condition of the top of the pelvic bones. We can see what it would look like if there was no extra volume here. It would look much more attractive because we have a more organic, natural difference between the iliac bones and the waist. A woman's pelvis is significantly wider than a man's for the purpose of childbearing. Ideally, there should be a difference between the waist and the pelvic bones. Accordingly, the difference between the iliac bones and the waist is perceived as an indicator of fertility and is perceived as a sign of beauty. The structures that are responsible for the lateral surfaces of the iliac bones are the oblique abdominal muscles from above. When we talk about the lower part of the iliac bones in the downward direction, we are talking about the balance between the gluteus maximus and the gluteus medius. The lateral surface of the body is the place where the middle gluteal muscle is located. If a person has insufficiently developed large gluteal muscles, the body involuntarily begins to develop the mid-gluteal muscles in order to compensate for the dysfunction of the large gluteal muscles. This leads to the pelvis being excessively flat and the top of the buttocks being excessively wide. It is possible and necessary to work with this. Very often, people forget that the buttocks are not only the gluteus maximus, but also the middle and small gluteus muscles, and it is important to work out all three of these structures. Another related problem that concerns the balance between the gluteus maximus and the gluteus medius muscle will be the excessive tone of the gluteus maximus muscle. It looks something like this. A huge number of people walk with their buttocks tucked up. This leads to an average portion being pumped up, and accordingly, the pelvis looks dry and unattractive. This can also be extremely harmful to your health because the constant and spastic tension of the large gluteal muscles leads to the interruption of blood circulation in the pelvic organs. A common problem, which is quite little talked about, will be a punctured gluteal muscle. The fact is that at the moment when we sit down, we have to get the flesh of the buttock from under the sciatic bones. Let me show you on the skeleton what I'm talking about. We have sciatic bones and we have a large gluteal muscle, which should be on top of the sciatic bone when we stand, and should go forward and sideways when we sit. Quite a common story. When people sit down, they sit on the gluteus maximus. When sitting this way, the muscle is between the hard sciatic bone and the place where you are sitting in the chair or stool. Muscles are elastic and muscles flow, respectively, and when you regularly sit on the muscle, it is pushed through by the sciatic bone, and a specific dimple appears in the lower part of the buttock. How to work with this problem? First, we need to release the iliotibial tract to allow the gluteus maximus to move forward and sideways when a person sits down. A related problem that we talk about will be the condition of the lateral surface of the thigh. The fact is that very often, due to the fact that the tone of the gluteus maximus weakens, and this leads to sagging in the tendons that go from the gluteus maximus to the iliotibial tract, which leads to the body filling the void formed with adipose tissue. Thus, the places along the tibial tract are filled with fat, and visually, the pelvis falls lower than it should, and the legs look shorter and the pelvis looks wider. The figure turns out to be mundane. A common problem with the buttocks is the insufficient tone of the buttocks muscles. This leads to the butt sagging. In order to train the muscles of the buttocks, a huge number of people spend a lot of time in gyms, but if there are problems with the sacroiliac joint, if there are problems with the intestines, there's no way to pump up the buttocks no matter how long and hard you work out. I have had more than one patient who spent a decade of personal training with a trainer and did not get any result, and after we worked on the CPS, after we worked on the lymphatic outflow of fluid from the inguinal lymph nodes, the result turned out in just a few weeks. And finally, the last problem that I will mention is the problem of the condition of the skin on the buttocks, or what we call stretch marks. This problem happens when someone gains a lot of weight and then sheds it. If the weight was gained too quickly, very often this happens due to the fact that the woman swells, the internal tissues under the skin diverge, and stretch marks form. Stretch marks not only do not look ideal, but also interfere with the circulation of fluid in the subcutaneous fat. It is important to understand that stretch marks are internal scars. Accordingly, when we have an internal scar, it interferes with the normal circulation of fluid and the normal circulation of lymph. Accordingly, our task is to make the skin detach freely from the muscle and from the fascia. Here we need to be very careful because our tasks are not to stretch the skin, but to make it free, elastic, thus allowing normal circulation of blood and lymph in the subcutaneous fat space. Well, in conclusion, I will say that a huge number of people spend an incredible amount of effort on training the gluteus maximus. It is important to understand how to train the gluteus maximus muscle. If the gluteus maximus muscle does not work and you want to take your leg back, then the body has two spare options for how to do it. First, the body can shift the load from the gluteus maximus to the square loin. This will lead to chronic pain in the lumbar spine and can cause hernias in the lumbar spine. The second way to compensate for the non-functioning gluteus maximus muscle will be excessive tension in the posterior surface of the thigh. This is also not ideal because it is on the back of the thigh that a large number of arteries and veins pass. Thus, excessive tension of the back surface will lead you to cellulite and varicose veins. In addition, the posterior surface of the thigh is part of the superficial posterior line. If we have excess tension on the back of the thigh, we will have insufficient tension in the area of the long extensors. Thus, the thoracic region will be excessively relaxed to compensate for the excessively tense posterior surface of the thigh. People can have problems, pain, impaired posture, spend a lot of time and effort, and still not understand that in order to cure the thoracic region, it is necessary to work with the buttock and the back of the thigh. If you're interested in what I'm talking about, if you have observed similar manifestations on your patients or yourself, please like the video. This way we will understand that the information we give you is really important and useful. Thus, if you want to create a better buttocks, then you have to perform 3 actions. First, to work out all those structures that we talked about in this video. Second, perform isolated exercises on the gluteus maximus. And thirdly, work with the lymphatic system. Thank you for joining us here today. My name is Stanislav Chernonog, the author and creator of the online school of vector massage and somatics and the YouTube channel of the same name. A channel where we teach you to be beautiful, healthy, learn massage, and make a career out of it. See you again, friends, and until next time, take care.